Hello and welcome to Norwood News. Today is Friday, April 10th, and I'm your host, Krista McDonald, back in the NCM studios. But I want everyone to know that we are closely following the social distancing guidelines. Over the past month, Norwood Hospital has been working to provide the best care to residents of Norwood and the surrounding towns. Let's go to the president, Dr. Sal Perla, for the latest information on hospital operations and the COVID-19 surge and readiness.
Hello, Dr. Perla here from Norwood Hospital, and reaching out to you today to provide an update of your local health system. As you can see, I am wearing a mask. It is our new policy here at the hospital. We'll get into that and talk about why we're wearing masks and what we're doing with others to wear masks. But for today's purpose of doing this, I'm going to take my mask off, but I did want you to know you are going to see everybody wearing a mask here at the hospital. So for today, we are going to start and talk about our status here at the hospital. As you can imagine, like most other health systems, we are seeing the surge. So we are busy here at the hospital. We are prepared. We're going to talk about what we've been doing to prepare and talk about where and all the functions here at the hospital. So the first and most important thing is a lot of people hear a lot about critical care and ventilators. And what have we done here to prepare for that? So with a really amazing dynamic team of our nurses, our leadership, our physicians, and all our support staff, we have been able to almost double our critical care ICU capacity. So we normally take care of up to 10 patients in the ICU setting. We are now going to be able to take care of 18. And that, what we call as an alternate care location, is already open. And we are already seeing patients in that area, which means we are seeing a lot of critical care patients. What happens, or what do we do if we actually expand that? What if the need is greater? Again, through all of our work with our members of the team, our nurses, our medical staff, and everyone, we have been able to identify additional alternate sites of location, which include our endoscopy GI center and our sleep center. So both of these locations are prepared, normally take care of individuals who require some type of form of anesthesia or some type of critical care medicine. So it's actually relatively easy for us to convert those to additional medical surgical beds or even an additional critical care bed. So that would bring our capacity up even higher. We do not believe we're going to need that, but we're always going to be prepared for the worst. Next is overall our volume here at the hospital. So most people know our medical surgical units are all in the LaRusso building. So we label those as L2, L3, and then the ICU is in that building. Today, we have dedicated COVID-19 units on those floors. So L2 has a dedicated COVID unit. There's 3 units on L2, 3 units on L3. On L2, we have 1 unit. On L3, we have another unit. Why do we dedicate the units? Well, obviously we want a cohort. We want to keep people that are sick with COVID in a certain location, and we want to keep people that are sick not with COVID in another location. We accomplish many things by doing this, but most importantly, we're doing what we want to do is keep those patients separate from each other. New. So we talk a lot about testing in people that are concerned about COVID, but we really haven't been talking about the people that have COVID. So people that have been diagnosed with COVID, there is follow-up care that is necessary. So what we have done here is we have created an alternate site location for chest x-rays. So many times doctors are looking to see if your chest has cleared. So we've created a alternate site in our COVID area. So you'll come in that same location where you got your test, let them know you're here for an x-ray. Again, your doctor needs to order that x-ray. You'll pre-register, and we'll do a chest x-ray and get those results back to your doctor ASAP, typically within 4 to 6 hours. The hours for that is Monday through Friday from 1 to 4. If you need a different date or time for your chest x-ray, definitely give us a call and we can try and find out an alternate location or time. Staffing and illness. So there's a lot of news and media associated with healthcare staffing illnesses. So we are very fortunate here through our great work with employee health and our staff being well educated on the use of PPE. We actually have a very low amount. There's two cases. There's either someone is out ill and we ask them to stay home, or they may be on quarantine. So if someone's on quarantine, it could be that they were exposed by a family member at home, they could have been exposed at work. Regardless, they're going to be quarantined working with employee health. In overall, Norwood Hospital has over 1,000 FTEs. We only have 20 individuals that are out of work at this time. We're very fortunate. We're doing everything we can to keep that number as low as possible. And the good news is, of that 20, 4 of them are already back to work. So we're in great shape with regards to operating here at Norwood Hospital. So I want to talk a little bit about community support, talk about PPE, in some other areas. But before we jump into community support, because it's just been so overwhelming, I do want to get through a few other items. PPE. So we get a lot of phone calls regarding donations. So the most important thing that we can have here is N95 masks. So where do I get an N95 mask? Why would I have an N95 mask? People who use N95 masks are very familiar. So if you're a sander or a painter, you might have even something called an N100 mask. So we can use those. A lot of people have been out of work, they can't go to work, and they may be a painter and have 5 N95 masks. And they think, well, that's really not much. Every little bit counts. So if you have those masks and you're willing to donate them, we would absolutely take them. They are really, for us, our primary defense against COVID for our staff. So we're happy to take those. Other donations, gloves, face shields, they're all great. Thank you. We're happy to take those as well. We want to talk about our visitor policy. So I know this is a very difficult time for a lot of people, especially individuals that have COVID-19 and are here in the hospital. We have changed our visitor policy to no visitors. We had to do this for a variety of reasons, but most importantly, we need to make sure that we're protecting our staff and the community itself. We found a few instances where individuals were coming in and just really didn't understand what you needed to do to keep yourself safe from the person you're visiting. And for us at this time, we really just can't have that type of distraction. We need to focus on our patients, and having individuals go in and out of the rooms, potentially exposing themselves, then bringing it back, exposing their family members and loved ones. It was just too big of a risk. So at this time, we're asking for no visitors. There are a few exceptions. So if you're having a baby here, which is very safe to do, we're actually very busy right now in maternity, a labor coach is absolutely welcomed. We're going to screen them as well because we want to make sure that our maternity floor stays very safe. Your labor coach can't have a temperature or be quarantined. And then as far as visiting the babies afterwards, unfortunately that's not allowed at this time. Most people do go home within 24 to 48 hours, so I know everyone wants to celebrate the birth of a new one, and we want you to celebrate too, but we need to make sure that everyone stays safe. With regards to other individuals looking for visitation, so on L2, L3, or the ICU, we're asking for you not to come in and visit. At this time, the only thing that we're allowing is an end-of-life care visit. I know these are very difficult times. People want to come in and visit, but we just can't do it. We really need to focus on the safety of everyone, including yourselves. So nursing homes, we want to talk about our local skilled nursing facilities, assisted living facilities. There's been quite a bit of media and news regarding them, especially here in Norwood and in some of the other areas. We want you to know what Norwood Hospital is doing to help those facilities. So we truly believe we are all part of one healthcare delivery system, and it's very, COVID-19 is very new for everyone, especially nursing homes and assisted living facilities. So when there is belief that there is a concern for COVID at those facilities, our hospital is reaching out to them, and instead of putting them in an ambulance and exposing our EMS and first responders, our staff here, our nurses, are training nurses over there to perform a nasopharyngeal collection, or going over there and actually collecting them themselves. We want to do everything we can to keep the amount of transmission through the public systems at a minimal. So if we collect the specimens or we train their staff to collect the specimens, those individuals get to stay in their bed. And we've done this probably 50 or 60 times already. And I have to be honest, a lot of people are fine. They might be positive, but they're staying there and they're working through it as well. And then in the instance, if someone becomes sick at a higher level of care, they transfer them to Norwood Hospital and we do take care of them. So we want you to know we're partnering with all of the communities. And a big shout out to our nursing staff who has really just taken the brunt of all this training. Leaving our hospital and going to another facility to help others is really just an amazing task, and we thank them so much for doing that. With regards to other community support, I have to say I'm overwhelmed with the support. I have a small list. This isn't the total list, but I just want to give a shout out to a few of the people that continue to donate. I understand there is something called the Friends of Norwood Center, and that is a fundraising procurement. So if you want to make a donation, it's going through this center, and then they are working on how to utilize local restaurants to help them as well, keeping them busy, and then feeding all of our staff here. And I have to say, we're pretty much getting something every day now. Lunch, breakfast, dinners, the support is amazing. So just a few notes. Panera Bread in Walpole, Waters Church in Norwood, Subway of Norwood, Roxanne's Taqueria, Joseph Pruell, Esquire, all these people using local restaurants such as Chick-fil-A and Subway and let's see here, more Panera, other things, face shields. So a lot of companies aren't making the products that they normally make, so they've converted to create face shields for us. And there are so many uses for face shields here, so we are very happy to take those donations. Corbus Pharmaceuticals, Dan O'Brien Kia, Corrine Jackson Photography, Crisp of Walpole, Norwood Youth Football and Cheer, Ideal Glass, Darger Financial, The Sage School, WD Development, Verizon, Tyvek suits. So that is something that we're starting to see a replenishment of. So if you normally have a Tyvek suit and you're not using them, that is something we could use. And I know a lot of people that typically use Tyvek suits might be bigger males. So the triple X's aren't really working great for our nursing staff. So small, mediums, large would be great. Let's see here, the OCC of Norwood, multiple deliveries from them. And then Easter Sunday, we'll all be here on Easter. IHS Market and Murph's are donating food for our staff on Easter Sunday. So I want to just, again, this is a small example. I'm sure I'll be back out here more and we will provide some additional information. Lastly, I want to talk about successes. So I know there's usually a lot of negativity and talk about mortality, which is anxiety, causes anxiety and it's disheartening, but I want people to know here at Norwood Hospital there are success stories. There are people that have been here on a vent for 10, 12, 14 days. They're coming off the vents, they're going to the med-surg units, and they're going home and they're going to be fine. We've had 3 amazing success stories this week of people coming off vents. So we want you to know people are making it, things are working, and people can survive and go on and be healthy. So we are here, as a reminder, we are here 24 hours a day, 7 days a week for our community. And if there's any needs that you find that aren't being met, we're working with all our primary care physicians. We can connect you with a primary care physician. There's quite a few people that we have been coming up positive for COVID that don't have a PCP. The Steward Network is doing telehealth visits. You can see a doctor through a telehealth visit in less than 24 hours. So that is our weekly update. Thank you so much. Thank you for all the wonderful support, and we hope everyone has a great Passover and Easter Sunday. Thank you.
Thanks, Dr. Perla, for delivering us some good news at this time. For the full update, check out Norwood Community Media's social media pages. Charlotte Walsh, owner of the Charles River Running, was sitting at home when she realized she needed to do something to help the community during this time in need.
It just came about because I'm sure, like everybody else, we're kind of stuck in our houses, but we know that there's so much good that needs to happen, and there's so many things we can be doing. And so I was looking around on Facebook, and I saw that a town near us was doing a similar project where they were reaching out to people for donations in their town. and then taking those donations and hiring the restaurants to cook and then deliver meals to first responders, hospitals, fire departments, police departments. And I thought, oh, that's such a great thing. Why wouldn't, why can't we do that in Norwood? And then being friends of Norwood Center, I have like a lot of like new contacts with businesses, in Norwood Center and around Norwood. And I thought it would just be a good project for Friends of Norwood Center.
Little did Charlotte know, Matt Brown and his cousin Juliana had the same idea brewing as well.
Me and my cousin, Juliana, were in discussions on, how do we help? How do we help? And the Nord Feeds the Front Lines is literally a word or two away what we thought of. And I remember, we were trying to think, how do we get the money and how do we set it up? And I can't believe I didn't even think of GoFundMe, but we were going through PayPal, and we're in the final steps. And she sent me a picture of the GoFundMe that Charlotte set up, and I felt a gut punch to the stomach. I thought to myself, I was like, "Oh, they beat us to it. We can't do anything." And we had a conversation, and rather than they beat us to it, it was they got their ducks in a line quicker than we did. So I reached out and said, hey, is there any chance that we could team up with this rather than stepping on each other's toes? And Charlotte opened her arms and said, absolutely. Absolutely. And I was blown away. I was so happy that she was so open to it.
Juliana O'Neill, a junior at Norwood High School, wanted to get her peers involved.
We're also getting the high school involved by doing weekly challenges through our student council Instagram, and for every person that participates, we donate $1 from the student council fund.
Not only is Charlotte, Matt, and Juliana helping the front lines, they are also supporting the local businesses.
And it's so special, just to give back, and you're really knocking off a few birds with one stone with the way that we're supporting these local eateries, but also like Charlotte said, giving back to those that are on the front line, that are facing this, terrible crisis right now head on.
As of today, Feeding the Front Lines has raised almost $10,000 and is raising its goal to $15,000. They had their first delivery to Norwood Fire Department on Wednesday, which was prepared by the Common Cafe.
I was talking with Mary Ellen, who is doing our scheduling for us, and she helps us with the Friends of Norwood Center. And I had remarked that we had received a very, very generous donation from Circle of Hope. And Circle of Hope is an organization that Charles River Running regularly donates to after our road races. And I feel like I said, we're just, Nora, we're trading money back and forth. And Mary Ellen said, it's a family, right? We just trade our money back and forth. And I thought that was such a perfect thing to say, because we are like a big family, and no matter what, Norwood is going to help out Norwood. It's such a beautiful thing. So
please visit the GoFundMe page on Facebook to donate to this amazing cause. Wednesday, Corbus Pharmaceuticals, a Norwood-based company, joined the effort to help the healthcare workers on the front lines during the COVID-19 pandemic by teaming up with a local business to make a very special and generous donation.
Corbus Pharmaceuticals, a Norwood-based company, is stepping up to help those in the front lines in the fight against COVID-19 pandemic by donating masks and 200 lunches to the healthcare workers at Norwood Hospital. CEO Dr. Cohen released this statement to NCM saying, "It's difficult to express in words the gratitude that we all have for Norwood Hospital. Being able to play a small role in supporting people on the front lines is a true privilege. This contribution means so much to us because we're able to donate food through Tastefully Done, a local Norwood catering business. Karen and her team at Tastefully Done have hearts of gold and have been close partners of Corbus since our early days. Corbus is so grateful for everyone on the front lines who are keeping us safe." Melanie Franco, Marketing and Communications at Norwood Hospital, is appreciative of not only Corbus's donation, but others as well, stating, "All of us at Norwood Hospital thank the many local businesses and community members for the outpouring of support we continue to receive. Your donations, well wishes, cards, signs, and more have been so helpful in supporting our mission of delivering compassionate care. We all entered healthcare to help others, and we find now that so many are offering to help us. We are grateful and humbled. Thank you for all your support. Thank you to our Norwood local businesses and our healthcare workers during this time of need.
Once again, thank you to everyone, especially our healthcare workers who continue to provide the best care during this uncertain time. We'll be right back after this break for some more town news.
We can all do our part to stop the spread of COVID-19 by staying home and taking health precautions.
Only leave your home to address essential needs and get some fresh air and exercise. And when you do, be sure to practice social distancing.
Practice social distancing while shopping. If you are at high risk, please inquire about your local pharmacy or grocery store's alternative hours for high-risk individuals.
Use remote modes of communication such as telephone or video chat, Skype, Zoom, Google Hangouts, Facebook Messenger, something along that line, instead of visiting friends or family in person.
Everyone must eliminate close contact activities, including close quarters pickup games. As the weather gets warmer, we can spend more time outdoors, but we must maintain social distancing.
Wash your hands often with soap and warm water for at least 20 seconds.
Avoid touching your eyes, nose, and mouth.
Clean things that are frequently used around your home, such as countertops and doorknobs, and any other surface that you may choose to use with a disinfectant spray, household cleaner, or a disinfecting wipe.
Cover your mouth when you cough or sneeze. Use your inner elbow, not your hand.
Stay home if you are sick and avoid contact with others.
Together.
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 Together, we can make a difference, slow the spread, and save lives.
Welcome back. Impact Norwood has been providing residents virtual services throughout the COVID-19 crisis. Program Director Aubrey Seal shares the various ways you can stay connected with the coalition.
Right now, the biggest concern for Impact Norwood is the mental health crisis that this coronavirus is causing, especially for people who had pre-existing mental health problems. They're only exacerbated by all of this, dealing with isolation. So we are in the process of trying to put together a toolkit for the community. Right now we have all of our great mental health resources on how to cope with stress and anxiety on our website. But we're actually putting together a social media toolkit. So town pages, all of our coalition members can continually post different resources for coping with anxiety and stress during this really difficult time. I would suggest making a schedule as best as you can. And one thing I've been doing with my youth ambassadors, we're still continuing to meet weekly via video conference, but every week we check in and talk about the positive things that have happened that week. But I also recommend just doing at least one thing a day that brings you joy. For me, that's either taking a walk or watching the Cincinnati Zoo's animal safari every day. They do a live video with animals, and limiting news intake because it's sad, it's depressing. It's important to stay informed, but it's also important to do it in a healthy way. We know that elders, they're especially vulnerable right now because they're isolated, but I think it's also really important to check in with people who are in recovery. And we're continuing to try and promote that message that being in recovery is difficult in itself, but a lot of what helps people recover is those social interactions, those group meetings, and some people might not have access to the technology to access those group meetings. So if you know someone in recovery, just check in on them, see how they're doing. So I think that's really important. And we're also trying to promote the fact that substances don't help you cope. They oftentimes make things worse. And alcohol is a depressant. So if you're feeling depressed, it might seem like turning to alcohol will make you feel better, but in reality, it doesn't. It might make you feel better in that moment. But there are unintended consequences that come with using those substances. One thing we're actually also trying to put together is like a parent, guardian, adult coffee hour once a week. So a virtual place for people to come together just to either vent or talk about what they're doing to cope. Kind of just an online support network for parents and guardians or any adult in Norwood. You don't have to have a kid to join. They can go to our website, impactnorwood.org. There's a contact us form, or I'm happy to have people email me personally. My email address is aciol@norwoodma.gov. I'm happy to take any questions that people have.
As you know, many town departments have drastically changed their operations amidst the COVID-19 pandemic. Airport Manager Russ McGuire explains how they're handling it at the Norwood Airport.
Because the Norwood Airport is a federally obligated tower, we're in the country's public use airport system. We are required by FAA and MassDOT Aeronautics to remain open. And in some offline conversations with both FAA and MassDOT, they have underscored that point, that the public use airports must remain open unless approved by FAA. We're strictly an on-demand type facility, and that tends to be seasonal. We notice that in the winter months, the demand drops off a bit. Although that, from day to day, that can change. In the good weather, spring, summer, and fall, we tend to get our highest operations. So what I've noticed is when I looked at March of 2019 and compared it to this past month, we had about a 10% drop off in the traffic. I think that if the COVID-19 crisis continues, the piloting community, which is also sensitive to this pandemic and is not flying in the numbers that we might otherwise have seen, I think the operations will continue to drop off. But we've posted the social distancing recommendations, washing hands, avoiding touching eyes, ears, nose. Staying home when you're not feeling well, and using hand sanitizers. We've actually posted that right at the security gates to the airport as a reminder. We've also put it out by email to all of the tenant businesses on the airport, actually in several emails. The MassDOT Aeronautics has asked us to actually post a notice, which is right here, just reminding anybody traveling to Massachusetts by air that they're urged to self-quarantine and monitor their health for 14 days as the state works to stem the spread of COVID-19. I've noticed that in the last few days we're getting more visitors to the airport who need that fresh air. So I welcome anyone who wants to get out and under the guidelines that have been put forth. Get some fresh air out here at the airport. You're certainly welcome. Tassos Eurocafe, the airport restaurant, is still open, as are the businesses on the airport, and that information is available on the town's website. So I hope everyone is well, and like every other department in the town, we're doing our best to flatten the curve, as they say, and I wish everyone well as we look to get past this pandemic.
Stay tuned after this break for some school and government news.
The town of Norwood has announced the launch of the Citizen Information Center for Norwood residents. a one-stop shop for questions, comments, and concerns residents may have during this unprecedented time. Town employees will be working remotely and will be taking calls Monday through Friday, 8 a.m. to 4 p.m. at 781-352-2363. Norwood residents are encouraged to call with questions about town services, food assistance, payment assistant resources, guidance on signing up for SNAP, assistance with submitting unemployment applications, and more. Call takers are prepared to research issues that may not have immediate answers, and will seek to connect individual with the resources or other area nonprofits as needed.
Welcome back. Organized annually by the Orient Lodge of Masons, the Norwood Teacher of the Year Award recognizes teachers for their dedication and commitment to the education of Norwood students. This year, 35 Norwood teachers have been nominated for the 14th Annual Norwood Teacher of the Year Award. These candidates, representing all the schools in the district, were nominated by colleagues, parents, and students who have shared stories of the teachers' exemplary work. Out of the 35 nominees, 5 have been named finalists for this year's award. This year's finalists are Christine Larea, a task teacher at Norwood High School; Karen Gorman, a first grade teacher at St. Catherine of Siena School; Janet Lynch, a special education teacher at the Cleveland Elementary School; Jason Andrews, a 7th grade ELA teacher at the Coakley Middle School; and Teresa Drummy, an English teacher and department chair at Norwood High School. Good luck to all these finalists. This year's Teacher of the Year will be announced Tuesday, April 14th on the Orient Lodge of Masons social media pages and on their website. Norwood News will have more from the winner next week. Now we toss it over to Brian Dunn with sports.
Hello everybody, and welcome into the sports update for this week. Back in the NCM studios, and as Kristen said earlier, I too am following our social distancing guidelines. My name is Brian Dunn, and we have a few quick updates for you. One, an update regarding the MIAA tournament picture. Track and field will have a cutoff date of June 21st at 6 o'clock p.m. with entries received by June 22nd. Sectional meets will be scheduled for June 27th and the 28th. The pentathlon will be scheduled for June 25th. That was a 12-0 vote by the board. And at this time, they did not choose an establishment date where spring tournaments would not be conducted, but the MIAA is always updating week by week, so the next meeting will be April 16th and a virtual meeting. And week 1 was a success, so we bring you our week 2 installment of the Mustangs at Home social media campaign, headed by Jared Shea, NHS athlete. Let's take a look. And that's going to do it for Sports For Me this week. Again, the social media campaign is open to anybody and everybody. So if you want to submit a video, please tag us on social media with the hashtag MustangsAtHome, or you can email me at bdunn, B-D-U-N-N, at norwoodcommunitymedia.org. And again, I want to remind everybody to please stay safe, stay healthy, and practice your social distancing, and hopefully we can get back to sports real soon. Kristen, back to you.
Thanks, Brian. The Sustainability Commission announced during their meeting on Monday that they will be canceling Earth Day this year. Although the physical events are canceled, they will be participating in a virtual Earth Day with some of the sponsors of the event.
Earth Day has been canceled, or as this April. We had basically the trash cleanup scheduled, and then community picnic and fair at the Common afterwards, and so we canceled those events, and we're going to actually go digital, like Brian was saying. We're going to start next Monday, so I'm just looking at the calendar now, April 13th, so next Monday through the actual Earth Day, which is April 22nd. So for about a week and a half, we're going to feature 1 to 2 of the organizations that was going to be at the Community Picnic and Fair. What we'd like to do is actually feature this group and the one new thing for the actual Earth Day on the 22nd. So through social media, Instagram, and Facebook. up on the website as well, but we would like to feature this group on actual Earth Day.
The Sustainability Commission's next meeting will be on May 11th, but the various subcommittees on the board will be meeting and discussing their business throughout the month of April. The Board of Selectmen convened inside Memorial Hall Tuesday night. Due to the COVID-19 pandemic, a few weeks ago the board voted to postpone the local town elections and seek advice on a rescheduled date. The board approved its new date for the local town election, which is now June 8th, 2020. Town Manager Tony Mizuko explains some added measures being looked into to ensure the safety of the voting residents.
So we don't know that that's going to be the date, but if we set it, at least we can get that out there, and it's easier to tell people this is the date, and then if it changes, we can tell them the date changes, as well as the notification. One other operational challenge we'll have, we think we've worked out a way to have, assuming we have an election on June 8th, sort of what we're calling a no-touch election. So for those folks who are going to have to come in person, because currently as the laws stand, we still have to allow people to come in and vote on election day, we think we can arrange the logistics in a way that you can come in, you'll be provided with some PPE, perhaps your own pen, go in and vote, and there should actually not be any need to have any contact between the staff that work the voting polls and folks coming in to vote. It's a huge logistical feat to be able to do that. We think we can make it happen. We've been able to move mountains in days, but having a date certain would at least let us reach out to some vendors where we need to procure some additional supplies and equipment and say, hey, if our goal is to make this happen, that's the date that it's going to happen. We would need to be ready a week or two ahead of time, but we think we've worked out a way to have what we're calling sort of a no-touch election.
Also, the board held a show cause hearing for Hibachi Steakhouse, who closed its doors a few months back. They have been given an extension into June to find a suitor for their liquor license. Tony Mizuko also mentioned the possibility of canceling interest on property tax payments to the town for this upcoming May 1st due date and asked for the board to extend the deadline to get further confirmation on notice requirements.
In relation to not charging interest on property tax payments that are due on May 1st, we've discussed that we do want to do it. The Division of Local Services just this afternoon sent out a circular talking about the notice requirements to do it, and they've changed substantially, and there was a cost to the way we do it before. We actually think those notice requirements are better. We just ask if the board will table it for a week so we can make sure we review them and make sure we're compliant with the requirement to get notice out in the appropriate manner. Road. So if it happens to be 2 weeks, that's fine. We will not be charging interest on tax bills that are not paid as of May 1st, as of any of our other bills. We're able to do that. We just don't want to trigger the notice requirements until we're certain we can make them happen.
The Board of Selectmen will meet again on April 21st. The school committee met virtually on Wednesday night. Mayev Bodenhofer and Chair Teresa Stewart discussed with the committee a possible special education reserve fund that could help balance the costs of out-of-district placements. The fund would need to be approved by town meeting. The committee also discussed the updated Memorandum of Understanding, which included COVID-19 emergency procedures and compensation. The school committee will meet again on Wednesday at 7 p.m. Wednesday night, the Community Preservation Committee met after having 2 months off. The meeting began with a discussion on the proposed projects that the CPC is considering. The second agenda item of the night was the conversation about the upcoming town meeting, which is scheduled to take place on May 11th. To end the meeting, the CPC discussed their ongoing projects and their work moving forward. Their next meeting has yet to be scheduled. Thursday night, NCM covered the Cultural Council for the first time. The board met to talk about a few items. They addressed how to communicate using a hashtag on social media during the social distancing period and gave an update on the current status of Art Week.
As you all know, Art Week has been canceled for this year, unfortunately. But of course, it's the safest thing to do since there were many public gatherings planned for that. Just a quick note about that is that it was really exciting to see so many people jump in and be willing to participate this year, sort of on short notice, but the excitement was there, and we're really looking forward to next year and doing something, and now we have more time to plan.
The Cultural Council usually meets on the first Monday of each month. For complete government coverage, tune into the NCM Government channel or watch it on demand at norwoodcommunitymedia.org. Stay tuned after this break for some more town news.
Hi, Sigal Reese, Norwood's Public Health Director. I want to remind residents that we are still following the governor's guidelines to stay home as much as possible. But I also want people to know it's okay to go outside and enjoy the outdoors. You can take a walk with your family or take a bike ride and get some exercise. but it's also important to maintain that social distancing from others and that 6-foot separation. You can also wash your hands before you leave and when you come home. But the most important thing is to avoid gathering in large groups. We don't want to see groups of people playing basketball or other contact sports, and we need to maintain social distancing. So definitely go out, enjoy the fresh air, but do it in a safe way, and together we can all stop and slow the spread of COVID-19.
Welcome back. 2 weeks ago, Alex Afanos talked with NCM about 3D printing N95 masks and donating them to healthcare professionals in need. Alex has nailed down a specific design and updated us on his progress.
So last time we talked, we were trying to figure out a model for a face mask and a model for a face shield, because now everything changes like within a day. So that's the latest. So for a face mask, we're going with the Wisconsin design. So that's this guy here. It has a little clip that puts the filter in place. So basically, the cool thing about this mask is if someone already has an N95 mask, they can take one N95 mask and make it 6 of these masks. So you basically cut 6 squares of the filter out. You put the filter on the inside, you put this piece in, snap it in place, and you've got your mask. So that's very cool. And then, because the other part of this challenge is making sure that none of that mucus gets to you. And so what we did was we made this mask here. So this uses materials that are available, because that's the other challenge with this whole thing is everything is out of stock. And if it is something you can buy, maybe the hospital's already bought it. So basically what we're using is, this is just the 3-hole punch plastic divider. You can get it at Staples. It's still available on Amazon. We're using elastic band in this case, but it prints in 4 hours, and might not hear me so well, but it works pretty well. So it's nice and simple. It takes about 4 hours to print one of these guys, but I think I can get it faster than that. We've got 4 of those made so far, and we're getting another 3D printer up to start churning these out. So we finally came up with a design that we're happy with to share with people, and we're ready to go.
Alex is donating his time to build these masks and just asked for donations of the materials that you can find on his website.
So we are in need of these here. So these 3-hole punch Avery dividers. I'm putting together an email list to get people organized for that. So if you can go to, I'll have the link here. It's on our website, ag3d-printing.com. It's the first link for coronavirus. Go in there. We have a survey. Just click what you can support. We're going to have an Amazon wish list where you can just click, buy it. It'll ship right to us, and we'll have that there.
Lions, tigers, and bears, oh my. There were over 600 bears spotted in Norwood neighborhoods last weekend. Don't worry, we're talking about teddy bears, and they were placed in windows on the front steps for a family teddy bear hunt. This event was organized on social media, and an interactive map was created to help children find the bears. Let's hear from one of the organizers and map creator, Joe Sleeman.
The goal was basically, partially just to explore a little bit of Norwood while maintaining a safe distance from people. Get out and about in these times where we're kind of stuck in the house, enjoy the weather, and find some bears in windows and yards and see how many you can find. So my role was basically collecting the data and putting it all on a map. So I created a Google form that basically collected the addresses and whether their bear was inside or outside, and then I compiled that data into a Google map and then distributed that on my website for people to find and access. It was a lot of fun. We explored kind of multiple areas in Norwood. We found over 200 bears ourselves after 2 days of exploring, which I thought was pretty successful. We had a lot of fun doing it. It was a good time. It was good to see both perspectives from the bears, people excited to see people finding their bears, and then kids finding their bears as well. It was fun to see kids kind of roaming the neighborhood in their cars, and slowing down at each house that they thought there were going to be bears at. What I think was accomplished was a reprieve from the chaos that is things that are going on right now. Something different to think about, which is always nice, a little low-key fun.
Who knew that there were so many teddy bears in Norwood? It's refreshing to see families walking together on the streets of Norwood and also following social distancing guidelines. Thanks to all who helped organize this great event. You helped families take a big break from COVID-19 and enjoy some time together. Great job. Well, that's all for Norwood News. To stay up to date with Norwood Community Media, follow us on Facebook, Twitter, and Instagram. As always, thank you so much for watching. Now we leave you with a video of Officer Greg Shore reading a children's book.
Hi everyone, it's Officer Shore from the Norwood Police Department. Just want to read a little Easter story. Hopefully some of my kids down at the Willett and all the other kids from Norwood Public Schools, or anybody else who wants to enjoy. I know we haven't seen each other for a while, so it's a good way to stay in touch for right now. Being at the Easter season, I'm gonna read a little bunny book. Guess How Much I Love You is the name of the story. All right, you ready? All right, let's get along. Little nut brown hare who was going to bed held on tight to big nut brown hare's very long ears. He wanted to be sure that big nut brown hare was listening. Guess how much I love you, he said. Oh, I don't think I could guess that, said big nut brown hare. Get big nut brown hare. This much, said little nut brown hare, stretching out his arms as wide as they could go. Big wide arms. Big nut brown hare had even longer arms. But I love you this much, he said. That is a lot, thought little nut brown hare. You can see little nut brown hare. I love you as high as I can reach, said little nut brown hare. All the way up. I love you as high as I can reach, said big nut brown hare. Even higher. That is quite high, thought little nut brown hare. I wish I had arms like that. Then little nut brown hare had a good idea. He tumbled upside down and reached up the tree trunk with his feet. I love you all the way up to my toes, he said. And I love you all the way to your toes, said big nut brown hare, swinging him up over his head. I love you as high as I can hop, laughed little nut brown hare, bouncing up and down. Look at him bouncing up and down. He's a silly bunny. But I love you as high as I can hop, smiled big nut brown hare. And he hopped so high that his ears touched above the branches. That's good hopping, thought little nut brown hare. I wish I could hop like that. I love you all the way down the lane as far as the river, cried little nut brown hare. I love you across the river and over the hill, said big nut brown hare. Ooh, even further. That's very far, thought little nut brown hare. He was almost too sleepy to think anymore. Then he looked beyond the thorn bushes, out into the big dark night. Nothing could be farther than the sky. Ooh, looking at the moon. I love you right up to the moon, he said, and closed his eyes. Oh, that's far, big nut brown hare. That is very, very far. Someone's looking out with him. Isn't that nice? Big nut brown hare settled little nut brown hare into his bed of leaves. He leaned over and kissed him goodnight. Then he lay down close by and whispered with a smile, I love you right up to the moon and back. Well, that was a nice little story, guys. I'm so glad I could join with all of you. Hopefully you and your families have a safe and fun Easter. I'll see you guys soon when you get back to school. Bye.